Good evening, I'm Assad Ahmed. Testing for coronavirus was called a game changer by the Prime Minister, with the target set by the government for 100,000 tests a day, which have now been met. But here in London, antibody tests are now on sale, which show whether someone has already had the virus. Well, at the moment, there are questions over its reliability, but that hasn't stopped a private clinic in West London offering them for £175 a time. Londoners are being warned to think twice before taking one, as James Waterhouse reports.
Test, test, test.
Who exactly is going to be tested?
The operational and logistical challenges on testing.
Test, test, test.
It's a word you almost hear as much as coronavirus, because it's a pretty important part of how we get out of this crisis. Broadly, there are two different types. Firstly, the swab test, to see if you have it. It involves a swab being taken in your throat or nose and looks for genetic signs of the virus. The second is an antibody test, to see if you have had it. Your body makes them as it fights the virus. This can be done through a small blood sample. As ministers try to swab NHS workers, more places around London are offering antibody tests for a price. On places like Harley Street and here in Hammersmith, set up by a group of entrepreneurs who say they've paid £150,000 of their own money for the lab equipment, which tests for antibodies. They're charging £175 each.
Is it right to charge people in these times?
I think it has to be charged, simply with the fact that it has cost us. We've invested hundreds of thousands of pounds into setting up this single facility, so having to do that means that we would like to recoup our funds. We'd love to have some support from the government.
Testing whether people have had COVID-19 and how long they're immune for is going to take time, months, maybe years. It also needs a large group of people. And as long as that time drags on in lockdown, you can expect more private enterprises like these to pop up. But they do come with risks.
At the moment, those sort of lab tests are being evaluated by Public Health England to see if they're suitable for this purpose. And as yet, they have not come forth with an opinion, which makes me feel that they're still looking at them and they're not entirely sure that they're fit for purpose. So my hunch would be if Public Health England haven't got access to a test that's fit for purpose, it's rather unlikely that a highly effective test would be available commercially.
And yet, if the equipment meets the right criteria, these places can operate, meaning uncertainty is also an opportunity for some.
James, as we just heard, there's some serious concerns about this, aren't there?
That's right, I said. We've had a strongly worded joint statement from Hammersmith and Fulham Council, as well as the local NHS. They say this is not an NHS centre and not endorsed by either the authority or the health service. They point out there's no government-backed antibody test yet because of concerns over reliability, and they urge people to think twice before parting with their money.
Yet they're still allowed to operate.
That's right. The authority does concede it doesn't need council approval or endorsement. Now, the centre are offering free tests for NHS staff, and they say the equipment is EU certified. They have applied for the official government certification, if you like, but the fact is, Assad, enforcement in this area does take time. It takes months, and in that time, plenty of money can be made because plenty of people are anxious.
Yeah, certainly are. OK, James Waterhouse, thanks very much for now.